This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're talking about tetanus. You know, the disease our parents warned us about. We know it's deadly, killing about 1 in 4 of those infected without treatment, but a lot of us don't know more than that. Like, what is it exactly? Is it contagious? How can we treat it? Or better yet, prevent it in the first place? Here to answer all our tetanus trivia is Dr. Priya Sampath-Kumar. Dr. Sampath-Kumar is an infectious disease specialist at Mayo Clinic in Rochester, Minnesota, and has the rare experience of treating tetanus cases firsthand. Dr. Priya Sampath-Kumar, thank you so much for joining us today.
Thank you for having me. I'm happy to be here.
We are so excited to have you here today to talk about something that we have all heard about. My whole childhood, I was warned, don't get near those rusty nails, don't play on that construction site, you'll get tetanus. But you know what's funny? No one even told me what tetanus was as a kid. What is tetanus exactly?
Tetanus is actually an infectious disease. You acquire tetanus by those things that your elders told you to avoid, stepping on a rusty nail, getting soil into a wound, etc. The tetanus bacteria lives in soil and in manure and places like that. And when you have a cut or a nick or somehow introduce this into your body, the bacteria produces a toxin, and this causes your muscles to spasm. And that's what tetanus is, a condition where your muscles become hyperactive and cause a number of problems.
When you're saying my muscles are becoming hyperactive, what exactly are my muscles doing?
Your muscles are contracting, and that causes your body to go into spasms. And sometimes that contraction can be so severe that you can actually break bones from that. Your breathing muscles and the muscles in your jaw can also be affected, and so you might choke. And it can cause cramping of your stomach muscles, resulting in severe pain, inability to breathe. And then your heart is also a muscle, so it can cause problems with that also.
Oof. Now, you mentioned some places I might contract tetanus that were not part of the script from my parents growing up. I was told rusty nails and construction sites. But you also mentioned soil and manure. Does that mean that tetanus is actually something that's part of just the natural organic world already?
It is. And that's why it's so important that we all get vaccinated, because it's everywhere. It's all around us in the world. And so it isn't limited to any one particular country. It's part of natural organic material.
Well, then why were we all told about those rusty nails?
I think because if you stepped on a rusty nail, that rusty nail would be a portal for entry. So if you were hopping around because your foot was hurting and then you stepped in the soil, you took your shoe off, etc., that would be how it got in. So the rusty nail wasn't the cause of tetanus. It resulted in a break in your skin that allowed tetanus to enter your body.
Oh, okay. I am learning so much already, and we're only a couple of minutes into our conversation. So if I were to contract tetanus from soil or manure or whatnot, would I be able to then pass that on to others? Is tetanus contagious?
It is not. So the bacteria enters your body, as I said, and produces this toxin. The toxin itself or the bacteria cannot be passed from person to person. So you're not contagious to anybody.
And how would I know that I've actually contracted tetanus? You know, I go on hikes, I walk in dirt a lot, I do gardening from time to time. How would I know that I've actually contracted tetanus versus, I don't know, had achy muscles from gardening?
You probably don't know anyone who's ever had tetanus, correct?
Not that I can recall.
The reason is that tetanus is exceedingly uncommon in the United States, and that's because almost everybody is vaccinated, and the vaccine is very, very effective. If you got your childhood vaccines and you do a reasonable job of keeping up with the adult vaccinations that are recommended, you should not be at risk for tetanus. The vaccines are so effective, even if you've missed a dose or so, you're still protected for a long time. The other reason why tetanus is so low in this country is that we're good about, even if you haven't been vaccinated before, you have a dirty wound, you go in to see someone and we automatically give you a tetanus shot. So if it's been more than 5 years for a very dirty wound or more than 10 years for a clean, relatively clean wound, you will get a tetanus vaccine at that time.
That's fantastic. But unfortunately, for those folks who have not been vaccinated for whatever reason, we do know that there is some vaccine skepticism in America and around the world right now. Let's say somebody isn't vaccinated and they contracted tetanus. How would they know that they'd contracted it?
The disease tetanus typically happens anywhere from 3 days to up to 60 days after the initial inoculation or entry of the organism into your body. And so if you've had an injury and a few days after that, you start noticing some muscle tightness, that could be tetanus. Now, muscle tightness is a very nonspecific term. And most people, if they've been doing something like heavy lifting, working in the garden, etc., you might have some achiness, but that's not what you should look out for. One of the signs of tetanus can be what's called lockjaw, where your jaw muscles clench and it becomes difficult to open your mouth. So that could be a tip-off that this is not just the usual achiness. But you would need to go see a medical doctor to really get diagnosed with the condition.
Let's talk more about lockjaw, because I've actually heard tetanus referred to as lockjaw by certain people. Are they the same thing, essentially? When someone's saying lockjaw, they mean tetanus?
It's a colloquial term, yes, that's used to refer to tetanus, and it's just one of the many ways that tetanus can present, though. So the two are used interchangeably, but you can get lockjaw from other things, including a problem called temporomandibular joint. There's a joint between your upper and lower jaw that can sometimes cause a condition where you have difficulty opening your mouth. So that's very different. It's associated with kind of pain in front of your ear and mostly diagnosed by dentists. So that's also sometimes referred to as lockjaw. The thing about the teeth grinding and the TMJ problems, although, are that they're relatively chronic, while tetanus is acute. If you have had this sort of thing going on for 2 or 3 weeks and it hasn't progressed, then it's not tetanus.
Got it. All right, let me pose a scenario here. Let's say I go on a hiking trip, I trip, I get all scratched up, some contaminated dirt gets into my broken skin. I don't know if I'm vaccinated or not. And a few weeks later, my jaw starts cramping and I get body spasms. I begin to suspect maybe this could be tetanus. So I go to the doctor, as you suggested, doctor. Are they going to give me blood tests or x-rays? What are they going to do?
So blood tests and x-rays are actually not very good at diagnosing tetanus. The best way to diagnose it is clinical exam, looking at how your muscles are behaving. Sometimes the doctors will ask you to open your mouth and gently touch the back of your mouth with a cotton swab, just like they do when they're getting a throat swab, for instance. That stimulus will cause your jaws to clench, and that can be the way they diagnose tetanus sometimes, because that's not a normal reaction. Usually you have a gag reflex. You feel like you're going to throw up. And patients with tetanus will actually just clench their jaws in response to that throat swab touching the back of their throat.
Okay.
So it's purely a clinical diagnosis. There are no confirmatory tests. And the key feature to the diagnosis also is reviewing the vaccination history of the patient presenting. If you've had your vaccines, it's very, very, very unlikely that you would have tetanus. And
let's say it's decided, yes, I have tetanus. What is the doctor going to do to me next?
There are several different things. So the first would be how you present, whether you have come in relatively soon after the injury. So if you still have active injuries, the first thing would be to clean out the wound and to give you antibiotics to help treat the bacteria in the wound. The second thing would be to treat the effects of this toxoid, this poison that the bacteria has released into your system. That is treated with giving you an antidote, which is called an antitoxin, and it's given IV, so it binds to the circulating toxin that hasn't yet attached to your body's cells. And then the third part of the treatment is dealing with the toxin that has already attached to your body's usually cells in the nervous system or the brain. And that treatment is basically not letting the toxin work. And so giving you muscle relaxants, usually things like diazepam or Valium. If the condition is fairly advanced, they may choose to put you on ventilatory support. So put a tube in your throat and connect you to a breathing machine so that spasm of your throat muscles doesn't cause inability to breathe until the toxin has been washed out of your system. So essentially, I'll just restate that if there's any wound, deal with the wound by cleansing it, cutting off dead tissue, and with antibiotics. Number 2 is giving you the antidote, which is called tetanus immune globulin. And number 3 is giving you muscle relaxants to prevent the muscles from contracting too hard.
Got it. Got it. And when all is said and done, is this a treatment that lasts a few hours? Is it an overnight stay in the hospital?
It could last from days to weeks. So depending on how much of the toxin is in your system. Typically, it is at least a few days. In addition to the muscle contractions, you can also have wild swings in your blood pressure and heart rate. And so all of these will need to be monitored, usually in the intensive care unit. Even after recovery from the acute spasms, some patients can be left with profound weakness in the muscles, and it can take months to recover from that.
Oh, goodness. So, doctor, you're making it sound to me as if tetanus is curable then, right? It's not just treatable. That antitoxin actually cures it, right?
So it's a little bit tricky. 3 out of 4 people with tetanus will likely make a full recovery if it's recognized and you get all these treatments that I've listed. The problem is early diagnosis is key, and most of us in the medical field have never seen a case of tetanus because the vaccine has been so effective. So all these presentations are things we only read about in textbooks. And so we may not think of it, we may not recognize it, and then we don't start treatment in time. The other problem is, again, because people aren't aware of it, they may not present to care. And so when you come in very late, a lot of the tetanus toxin has already bound to different parts of your body. And in that case, the immune globulin or the antidote doesn't work very well. So it isn't something that you are guaranteed a recovery from. Again, 1 in 4 people with tetanus continue to die even with effective therapies. And then in other parts of the world, the situation is much more dire. So there they have the advantage of being able to recognize tetanus, but the tetanus immune globulin may or may not always be available. And then the supportive care, including care in intensive care unit, may not be available. So worldwide, it's estimated that about 20 to 30,000 people still die of tetanus every year.
Oh, goodness. You said that there can be spasms and so on. Are those similar to like a seizure, or is it less predictable? Is it a constant thing or sporadic clenching of the muscles?
So it actually looks almost like a seizure because people are tensing up, and the natural instinct of anyone who sees a person like this, you want to comfort them, and touch is the most comforting thing, right? But touch actually sets off another spasm.
Oh.
So this can be very distressing to everyone around. These patients with active tetanus are usually cared for in an environment that is quiet, that is dark, because light, touch, sound can all set off these muscle spasms, which look very much like seizures.
And there's also neonatal tetanus, cases that involve newborns. What about those cases where a parent or caregiver's first instinct would be to hold the child?
This is the form of tetanus that's most prevalent worldwide. And when mothers are not immunized, they're not able to transmit any antibodies to their infant. When infants are born, many times around the world, they're born at home, not in a hospital. And the umbilical cord is cut with non-sterile instruments. And sometimes in some parts of the world, mud or cow dung are actually used to cauterize the umbilical cord. And when the baby gets what's called neonatal tetanus or tetanus of the newborn, just touching the infant sets off worse muscle spasms. And the mortality rate or the death rate from this is very, very high. And this is the leading cause of tetanus-related death around the world.
Oh, that's heartbreaking. So it turns out those warnings we heard about a cut causing tetanus were only half true, huh? Tetanus is a bacteria generally found in soil or feces that gets into a wound. The infection isn't caused by the wound itself. In days or weeks after infection, you may notice your jaw locking up, followed by muscle spasms. The spasms could break bones or impact your ability to breathe or prevent your heart from keeping a steady beat. Just like in the case of a seizure, the person experiencing the spasms shouldn't be touched or placed around loud or bright surroundings, even if that patient is a child. If you notice any of these prolonged symptoms after an injury, it's definitely time to seek medical attention. Providers can do a clinical exam and give you antibiotics and the antidote to clear the tetanus out of your system, maybe even assisting your breathing with machines in the process. That being said, even after treatment, it might take your body weeks or months to recover. Tetanus isn't contagious, but it is a very serious, though curable condition. And it's rare, at least in the United States. So rare, it might be difficult for providers and patients to recognize it in the moment. That's why it's so important to keep up with vaccines throughout your life. Let's see what's actually in these vaccines and how effective they really are. All right, I think I've got a solid understanding of tetanus as a whole, so let's get into prevention, namely the vaccine. I've noticed there's variants like TD, DTaP, and Tdap. Can you break those down for me?
So D, T, and P refers to the different components of the vaccine. So D stands for diphtheria, T stands for tetanus, and P stands for pertussis or whooping cough.
Yes.
And when they're all capitalized, that means that the vaccine has large amounts of the antigen. DTaP is the vaccine that's given to children, and so it has larger amounts of each of these three individual products. The other vaccine that is given to adolescents and adults is called TDAP. And here it's capital T, small d, small a, and small p. And the adolescent and adult vaccine, TDAP, has high quantities of tetanus, but smaller quantities of diphtheria and pertussis or whooping cough. So that's the difference. And the A just means acellular to distinguish the currently used vaccines from the older vaccines that were called whole cell vaccines of pertussis.
Thanks for explaining all those letters. To a lot of us, they just seem like alphabet soup. Now, you mentioned that vaccines for mothers who are expecting passes the immunity onto their children, right? Other than pregnant women, are there other people we should be really focusing on as far as vaccines go and making sure they're vaccinated?
The TDAP vaccine is recommended during pregnancy, primarily so that the pertussis or whooping cough immunity is passed on to the infant. The tetanus immunity, by the time you become pregnant, you should have had multiple doses of the DTaP vaccine in childhood, and the tetanus immunity is very durable. That means it lasts for a very long time. So it isn't necessary to just get the additional tetanus boosting during pregnancy. We don't have a standalone pertussis vaccine, so we give the Tdap vaccine, which protects you against tetanus, diphtheria, and pertussis during pregnancy.
Got it. And what about vaccination for infants?
Infants start getting the DTaP vaccine at 3 months of age. They get 3 doses of that vaccine, and then they get additional doses at 18 months and at 5 years of age. So children are fully immunized by the time they're 5 years old. And then after that, they get boosters periodically. So the next booster would be due around age 12, and then periodically at 10-year intervals after that.
Now, about 2/3 of recent tetanus cases have been in people ages 50 and older. Is there a specific reason behind that statistic? And should people over 50 be getting another booster?
Everyone should be getting these 10-yearly boosters. So by the time you're 50, you should have hopefully had your primary series and then at least 4 boosters. What happens is that in the United States, we are very good about vaccinating children for the most part, unless, they have parents who object to vaccines. We don't have as much infrastructure to remind adults to get their vaccines. So if you got all your childhood vaccines, even though you're supposed to get 10-yearly boosters, the tetanus vaccine is very durable. The protection lasts for longer than 10 years. So, you sort of get by and for several years despite not having had your appropriate boosters. But by age 50, your childhood vaccines have finally worn off, and that's when you become susceptible to tetanus if you haven't had your boosters. So we don't need anything special for people over 50. They just need to follow the usual adult schedule and they'll be fine.
And as far as vaccines go, we've already talked a little bit about vaccine hesitancy. Are there any risks associated with the tetanus vaccine?
Like with any kind of medication, there is the small chance that you could have what's called an anaphylactic reaction, which is an allergic reaction to the vaccine. That can be treated with medications immediately, and there has never been a death related to anaphylaxis to the tetanus vaccine in the United States. The other thing that can happen is something called an Arthus type reaction. This happens when people are too enthusiastic about vaccines or their providers are too enthusiastic in vaccinating them. And if you get multiple doses of the tetanus vaccine, you can get a swelling at the site of the vaccine that is very painful, and sometimes a swelling in the joints just above and below where you got the vaccine. So that happens typically in people who have gotten vaccines on a yearly basis because they didn't know their vaccine history. They kept getting injured and somebody gave them the tetanus vaccine each time they got injured. Otherwise, it's not generally a problem in people who get spaced out vaccines.
So it sounds incredibly safe, not a single death related to vaccination. What would you say then to a patient or parent who might still be wary of vaccinating themselves or their family?
Vaccines are really the biggest success story of medicine. They have saved countless lives around the globe, and they continue to be so helpful in so many different conditions. So I would say that these vaccines have been tested. They have a very good safety record. They can save your child's life, and I would seriously encourage parents to reconsider if they're thinking about either not getting their child vaccinated or delaying vaccines.
Yeah, and I would also just add to that, the worst case scenario to a vaccine, as you said, is something that nobody has died of. And the worst case scenario of not being vaccinated is something that people all over the world do die from. And you've personally seen tetanus cases up close, haven't you?
Yes, I grew up in India and I did my initial medical training in India, and I've unfortunately seen both adult tetanus and neonatal tetanus. I took care of 3 patients and 2 out of the 3 survived, but it was heartrending even for the survivors to watch them go through tetanus.
So one last question. I think the vaccine for tetanus 100% makes sense. Everything we've talked about today backs that up. But I'm sure some people listening are going to say, if it's so rare, if so few people get tetanus in the US, why do I actually need to be vaccinated against it?
That's such a great question. The reason that tetanus is so exceedingly rare in the United States is because we vaccinate. We vaccinate in childhood, we vaccinate at set intervals during adulthood, and if you've ever had an injury and you've gone to the ER, you've probably received a tetanus vaccine in the emergency room. So all of these vaccines, the multiple doses of the tetanus vaccine you've received, is what keeps tetanus rates so low in this country. The tetanus bacteria itself is all around us. It's everywhere. And if we stopped vaccinating, we would just have huge numbers of cases. So just because we've controlled the disease doesn't mean we can stop vaccinating, especially with regards to tetanus, because vaccinating other people doesn't protect you. You have to have had the vaccine in order to be safe.
Well, Dr. Priya Sampath-Kumar, thank you so much for all of the wisdom and the knowledge you shared with us today. We really appreciate it.
Thank you.
The tetanus vaccine is usually combined with doses of 2 other bacterial infections, diphtheria and pertussis, aka whooping cough. The capital T, Tdap booster, which includes vaccines for all 3, with the largest dose being for tetanus, is recommended during pregnancy because mothers can pass their immunity on to their child. After the mother gives birth, their child should get multiple doses of the DTaP vaccine before the age of 5. The shot includes significant quantities of the diphtheria, tetanus, and pertussis antibodies. Then there's another round of the Tdap vaccine at around 12, and then again every 10 years or so. And if it's been a few years since someone's had a booster, they may need the TD vaccine after getting a vulnerable wound. Vulnerability to tetanus doesn't rise with age, but we find that most of the rare cases in the U.S. are within the 50-plus population because their vaccines from childhood have finally worn off. Booster shots last for at least 10 years. The tetanus vaccine has been around for nearly a century. It's been proven time and time again to be extremely effective, and it's actually saving lives. No one has died from a tetanus vaccine, but plenty have passed from not having the shot. So check your records. Are you and your loved ones up to date on your Tdap vaccines? If you're not, ask your provider about getting a booster. The peace of mind is worth a little pinch. Okay, that's all for this episode. But if you've got a question or topic suggestion, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Health Matters episodes and resources, head to mayoclinic.org/healthmatters. And if you found this show helpful, please subscribe and make sure to rate and review us in your podcast app. It really does help others find the show. Thanks for listening, and until next time, take care and stay healthy.